my name is Kelsey, and I'm going to be your student nurse today. Okay, how are you feeling?
Good.
Good. I'm here to give you your IM injection.
Okay.
Okay. Can I have your name and your date of birth?
Alicia Prosperi, 2/12/95.
Okay, and I'm just going to scan this as her second form of identification. Okay. So I'm going to give you your 10 rights for medication administration. Okay. I have the right patient, the right medication. At the right dosage, I'm going to be giving her 1 milliliter of this medication in her deltoid, so the right route. The right time, it's 9 a.m. The right assessment, I performed her assessment, took her vital signs. The right documentation, which I will be doing following the administration of the injection. Right to education, I explained to her the procedure. And the right evaluation, and the right to refuse. Okay? So I'm going to perform my hand hygiene. Okay. Put my gloves on. Okay. And since it's 1 milliliter, I'm going to be doing the injection in the deltoid area, like I previously said. Okay. So first I'm going to take my alcohol swab and cleanse the area. Okay. Place that right there. Okay, and the needle I'm using is a 22 gauge and a 1 inch needle. Okay. So I'm going to draw my 1 milliliter of air. Okay. Inject it into the medication. Okay. And draw up the medication. Now I'm going to take my site and squeeze the muscle. I'm going to inject it. I'm going to aspirate to look for any blood return, and there is none, so I'm going to continue with the injection. Okay. Alright, I'm going to put my safety on. Cleanse the area again. Okay. And I'm going to document the amount of medication, the medication I used, and the site, which was the deltoid, and I'm going to dispose of the needle in the sharps container.
Go.
Hi Alicia, my name is Kelsey. I'm going to be your student nurse today. Okay, can I just have your name and your date of birth?
Alicia Prosperi, 2/12/95.
Okay, perfect. How are you feeling today?
All right.
Good. Okay, I'm gonna today we're gonna get you up out of bed and move you into the chair. Okay.
Okay.
Okay. So first I would wash my hands. Okay, and I would put on my gloves. Okay. And I would be sure to check that Alicia has on the non-skid socks or some type of slippers or something, so she is able to get up without, having any chance of falling. Okay, so what we're going to do is we're going to first get you to dangle your feet at, sitting up on the edge of the bed. Okay, so I'm going to first have you bend your knees. Before doing any of this, I would lower the bed in a position that makes it easier to get her out of bed. Okay, I'm going to have you turn on your side. Okay. And I'm going to have you sit up. I'm going to grab under your knees. Okay? How do you feel, okay?
All right,
I'll
good.
just have you rest like that for a couple seconds to get you, comfortable and ready to get up, okay? Okay, so I'm going to now put the gait belt around her, okay, to make it easier to move her, okay? I'm going to make sure that the bed is locked, and so is the wheelchair. Okay, so on the count of 3, we're gonna rock, and then on the count of 3, we're gonna get up and, move you over. Okay, and then
Okay.
sit you gently into the wheelchair. Okay, so what I would do is I would place my foot in between her 2 feet, and I would use the proper body mechanics, bend at the knees, keep my back, my body in alignment. Okay. So on the count of 3, okay, we're gonna rock 1, 2.
There you go.
Pivot. And place her How are you feeling? Okay.
Alright.
Good. Okay. So then she'd be in the chair and do whatever she has to do now to put her back into bed. We're gonna just do the reverse. Okay. So I'm gonna position my body in the same way and just move her in the opposite direction to have her sitting back, dangling along the bed. Okay. So you ready to get back into bed now?
Ready.
Okay. So I'm gonna grab the gait belt. Okay, on the count of 3. 1, 2, 3. Okay. And then we just do the reverse again. Okay. And I'm just gonna have you bring your knees up. Okay. And how do you feel? Okay.
Good.
So then I'm gonna put the side rails up and make sure the bed and everything is locked again. Okay. Then I would remove my gloves and perform hand hygiene. Hi, my name is Kelsey. I'm going to be your student nurse for today.
Okay.
How are you feeling?
Alright.
All right. I'm here to change your dressing. Okay. So first, what I would do is I would check the order for the dressing change against the physician's order, which is an order for a dry, sterile dressing change. So what I'm going to do first is perform my. Well, first I would identify the patient. So your name and date of birth for me.
Alicia Prosperi, 21295.
Okay, and I'm gonna just scan this as their second form of identification. Okay, so now I'm going to start by performing hand hygiene, and I'm gonna put on my gloves and remove the old dressing. Okay, I have all my equipment here. I have the biohazard disposable trash bag where I'm gonna place all the soiled items in, and I have my sterile gloves and my sterile kit here with me. Okay. So first I'm going to remove the old dressing. Okay. Gently. Okay, and as I'm doing this, I'm performing a skin assessment by checking this site of the wound and seeing if there's any signs of infection or drainage or such. So then I will dispose my gloves. Okay, I'll perform my hand hygiene again. So now I'm going to first open this before I put my sterile gloves on so I don't contaminate my sterile field with the outside of the package. Okay, so I'll put this here. Now I'm going to set up this to put my sterile gloves on. Like that. Okay. So I'm going to set up my sterile field over top of this. Okay, it's my sterile area. I'm going to put all my, what I'm going to do is I'm going to take my swabs, okay, and cleanse the site, okay. I'm going to go from the inside to the outside, okay, the least contaminated, okay, to the most, like that. And I only use each one time. Dispose of them when I'm done. So now I'm going to place the new dressing to the top. Okay. Like this and like that. Okay. I'm going to take my tape, tape it down, find where it starts. Sorry, just bear with me. Let's see. I'm going to use the other one. Okay, now what I would do is I would initial and date and put the time of the dressing change, okay? And I would document it accordingly.